Welcome my colleagues and my dear students. Today we are speaking about an important clinical application in cardiovascular physiology, which is the physiology of hemorrhage. As we said before, the cardiovascular system is a closed system that maintains its blood inside the vessel. However, if this blood is moved away from vessels, we call the condition a hemorrhage. So hemorrhage is blood loss outside the cardiovascular system. Hemorrhage can be classified by many methods according to the science that studies hemorrhage. We can classify hemorrhage according to its site into external hemorrhage and internal hemorrhage. Internal hemorrhage is not seen. It is inside our body cavities, inside the stomach, inside the intestine, inside the peritoneum, inside the brain, intracranial hemorrhage, and so on, and it is a serious type of hemorrhage. We can classify hemorrhage according to the amount of blood loss into mild, moderate, and severe hemorrhage. Mild if we lose a few milliliters, moderate if we lose about 20% of our blood, and severe if we lose more than 30% of our blood. If we lose about 20% of our blood, our body can compensate. However, if this volume exceeded 30%, our body can't compensate and it has to receive external support. According to the rate of blood loss, we can classify bleeding into arterial, venous, and capillary bleeding. The life-threatening type is the arterial bleeding because of the very rapid rate of blood loss. What are the principal manifestations of hemorrhage? First, the arterial blood pressure. The arterial blood pressure may be decreased during hemorrhage. However, persons can have serious internal hemorrhage, but their blood pressure is still normal. It will decrease, but later on. So when you find that blood pressure is normal, this does not exclude presence of hemorrhage. However, if arterial blood pressure is decreased with hemorrhage, this is very bad sign. Number two, pulse is rapid and weak, and this is the most sensitive sign of the internal hemorrhage. Take this in memory. The most important sign for internal hemorrhage is the rapid and weak pulse. When you find a person that is exposed to something that could cause internal hemorrhage and you find that his pulse is above 100, you must suspect the internal hemorrhage. This is the most sensitive sign. Don't forget it. Third is the respiration. Respiration may be rapid and shallow. However, this sign is not sensitive. Another sensitive sign is the skin. You can diagnose internal hemorrhage far away from the patient. By looking to his skin, you will find that his skin is moist, is sweaty. So if you find that the skin is sweaty, the skin is cold, there is tremors, and there is some degree of cyanosis, they are sure signs of internal hemorrhage in a suspected person. We have also oliguria. However, this sign correlates with chronic hemorrhage. Fainting may be a sign for hemorrhage. However, persons with life-threatening internal hemorrhage can be fully conscious. But presence of fainting together with suspicion of internal hemorrhage, this is very bad sign. Regarding effects of hemorrhage, we can divide them into two main topics: immediate effects, second, delayed effects. The immediate effects is the immediate response from our body in order to face hemorrhage and in order to maintain life. However, delayed effects try to restore everything to its normal value. This may take several weeks. Regarding the immediate effects, first, in the cardiovascular system, we have very rapid responses which aim to maintain the arterial blood pressure. First, increase in the heart rate. The heart acceleration try to increase cardiac output and increase blood pressure. Vasoconstriction. The generalized vasoconstriction all over the body is so significant because it saves the blood to the vital organs, which are the brain and the heart, on the expense of other less vital organs, which are mainly the skin. So the presence of skin vasoconstriction, which is manifested by the sense of cold and the cyanotic appearance and pallor, this is a sign of severe internal hemorrhage. Second, contraction of blood reservoir. We have the spleen, and it has about 250 milliliter blood. It contracts and pours them inside the general circulation. Respiratory changes. There is a state of accelerated respiration. The significance of exaggerated respiration here is to increase negativity inside the chest, and this acts as a suction power which increases venous return and subsequently the cardiac output and subsequently the blood pressure. We have also blood changes, which include first, increased release of tissue thromboplastin. This is important procoagulant in the extrinsic mechanism, thus help to limit blood loss. Also, there is increased the release of serotonin. Also, it causes vasoconstriction and limits blood loss. We have important hormonal changes which work within minutes. First, increase in the catecholamine secretion, which increase heart rate, increase cardiac output, and help to maintain blood pressure. Also, glucocorticoids, which support the general circulation. Also, there is increase in erythropoietin. So there is increase in the ADH, which maintain the blood volume, aldosterone, which maintains the body water and the body sodium. All these hormonal changes help to provide immediate support to our circulation. The delayed effects of hemorrhage aims to restore everything to its value before the occurrence of the hemorrhage. First, restoration of plasma volume. This may take from 1 to 3 days. Replacement of plasma protein. This may take about 1 week. Replacement of RBCs. This may take from 3 to 6 weeks. Tissue repair. This is variable. And finally, recanalization of the closed vessels. Finally, we reached the end of this simple lecture. However, the item of hemorrhage has many applications regarding diagnosis, regarding management, regarding causes, which will be discussed later on in the coming lectures.